So namaskar everyone and welcome back. Welcome back to my channel and this specific playlist which you're watching about Kent's understanding, Kent's repertory. We did a lecture on Kent's repertory and how to repertorize, and I will be adding few more videos as per whatever best I feel, especially in terms of practical knowledge. Kent philosophy, what philosophy it is, what he talks about, everybody knows, all homeopaths know. So there's no need to talk about those basic aspects. But now the need is how to go ahead and understand it more practically and use it in our practice. That is important. So many times there is a lot of, what do you say, a lot of classification and a lot of confusion also in homeopathy. Like even if you go to the basics, like somebody will say boric is good. Like I've seen physicians who are of Boric origin, okay, who believe in Boric like books, like pathological books. They will always be in opposite direction, standing with Kentinian approach. And people who are Kentinian, they will always be in opposite. Like people are criticizing each other and trying to prove all the things right. Their aspects right or wrong. So what I'm going to do is that as whatever is the clinical practice has gained me the experience, I'm still learning a lot of things. I have to still learn, but few aspects, all the wisdom that I have been collecting, I want to share it to my crowd, and I just want to give it to everybody so that it's not that whatever I'm going to talk about is the reality, is the fact. No, there could be a lot of upgradation in understanding. People can upgrade themselves and understand even better, but whatever is going in my mind and what things I'm understanding, I will be trying to post, especially in this lecture, in this series of Kent. Now I was reading one chapter. If you have your book, Kent's lesson writing, if you have lesson writing, so you can go to page number 444, or if you have a PDF, I think topic number 59 it is. The topic says like this, so I'm not making any presentation out of it because I just want to talk from heart, whatever I felt. The topic is symptoms and aspects of such cases as present an unfavorable view and cause an unfavorable prognosis. So now he's talking about those cases which cause unfavorable prognosis and unfavorable view. Now there are so many cases where we don't get results and we are stuck. Uh, so what are those cases? And more important than curing a patient, a homeopath should know where the direction, what direction the disease is going. If somebody comes to me and I'm treating the patient, every homeopath wants to cure everybody. Whoever comes, we want to cure everybody. But we forget that according to Kent, if you Kent was a master, the work that Kent has done is amazing. He has said something in his observations, the 12 observations that he has. There are so many observations where talks about that patient is not going to get better, patient just not going to get better, or your remedy is wrong, or case is incurable. There is only three observations where there are chances that patient can get better. Okay, so in that aspect, as a physician, to reduce our frustration and to do a judicious work, it is also very crucial to understand the case which has come in front of me, not always blaming myself that as a homeopath I'm wrong, I'm not understanding. Of course we have to upgrade our skills, but it cannot happen that every time homeopath is wrong. Sometimes it happens that even if your best effort, best repertorization, best understanding of Mater Medica, best potencies that you give, still nothing happens. The frustration creeps in. Rather than frustration creeps in, the idea should be we should be aware what is happening and why it is happening. If results are not coming, then why it is not coming. Maybe the patient will not get better, that's okay. But we as a physician, our wisdom as a practice increases, should increase that yes, these are my limitations, and this is what if happens in the patient, then I can cure. So what unfavorable prognosis he's talking about. So I'm not going to read everything because I want that people should go and read. Okay, read. I'm not here to narrate everything. This lecture is only to motivate you so that you go and start reading the old literatures. And once you start reading old literatures, your mind will start becoming, you will start becoming thinker. That's the entire purpose of it. So I'll read few paragraphs and few lines. An experienced homeopathic observer knows very well that burning, stinging, enlarged glands, infiltration, hardness of part, weakness, loss of flesh in cirrus of mammary will not lead to a remedy. So when I read this, what he's saying, suppose there's a patient who's come to you with mammary, serous gland enlarged. Cirrus means hard tumor, hard tumor. There's a mammary induration, and she comes to you and she is describing symptoms like burning, stinging. Okay. You see, lost lot of enlarged glands here, axillary glands are enlarged, induration of mammary. There are rubrics like that. He says that if you look at these symptoms, patient is not going to get cured. Now, this was something very strange for me because I see a lot of pathological cases and I've been using these symptoms of the patient right now. What's happening? The present predominant symptom, the sensations, the pathology I've been taking in my repertory. Because I use a lot of pathological rubrics. So for me, this was like, oh my God, what is he saying? Then he goes further. This will not lead to a remedy that will act curatively. Also, that edema of extremities, weakness, albumin in urine, heart symptom, dyspnea, anxiety furnish no basis for the remedy of the patient. So there are rubrics like, urine, albuminuria, there are rubrics like edema of legs. These are pathological rubrics, basically. What he's trying to say is that those rubrics has no meaning. It will not lead you to any remedy. Like it will not lead you to remedy. It will lead you to remedy, but not cure. That's what he's trying to say. All know that remedies given on such symptoms, he says, if you give remedies on such symptoms, are only expected to comfort and will not restrain the progress of disease nor very much prolong life. What is he saying? If you give remedies on these symptoms, then definitely patient will get some relief, but it is only comfort. The real cure is not going to happen. Now, this paragraph made me a lot of thinking because see, the way I have grown in homeopathic practice, I follow a lot Burnett's theory, Boger, BBCR, Fatak, pathological rubrics. I use a lot because that's the kind of cases I see. But what he's saying is also right because when I introspect myself, he's saying that you will not have some great results in these cases, which is also true because in many of my cases, where I see third stage cancer, fourth stage cancer, many of my cases, I see that with all my due great effort, whatever best effort I do, but the desired results is not there. Now, what does that mean, desired result? Because homeopath sitting there is always thinking of cure. All the way, the cure is a very relative term. You can't use it even at least today in this generation. In this time, you can't use this word. Like you can't say I cure thyroid. You can't use this. Legally, it is a problem. But inside as a homeopath, I'm always looking to have that shift. So I have seen in a lot of cases that I've been able to give a lot of relief to the patient, but many cases just relief, maybe not lifelong cure or the result that I was thinking to happen. But there are cases where things have moved very nicely also. So what am I doing is I'm analyzing both the things. I've not kept it to some seniors or somebody to tell me. I said I've got more than 15, 16 years of practice. So now I have started thinking whatever I have seen, my cases, my seniors' cases, my colleagues' cases, I want to think and understand what is he trying to say. Is he contradicting, or maybe I am doing something wrong when I'm using pathological rubrics, when I'm using Borek, Fatak? Am I doing something wrong? Okay. So he says know all know that above manifestations are representatives of sickness that ultimately upon the patient but do not signify and show forth signs of symptoms of the patient. He says all these rubrics, all the symptoms that you will take, these are symptoms of disease, not patient. And this is the center point of Kent. Kent always keeps talking about that. You should always take symptoms of patient. Symptoms of patient. What are symptoms of patient? I have already described in last lecture. Case taking the general symptom that he talks about, the aggravation, the modalities, mental longings, cravings, uh, aversions, all those aspects of it, thermals. He says those things are very important. The symptoms of patients, mental causes, all those things. He says the symptom that you're taking, disease symptom, is not important. So when you read, there's also one paragraph, one short paragraph about pathology, importance of pathology, something like that. So what Kent's view is that Kent says that if the symptoms of patient matches what disease patient has, it has no value. Even if the disease is not there or the pathology is not there in the remedy, still the patient is going to get better. But there is another school of thought which all talks only about pathology, 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 right? So this creates sometimes a lot of confusion whether this is right or this is wrong, right? So what he says is, I'm just trying to understand what he's trying to say. Then I will, at the end, I will try to come to a conclusion. Okay, and I will tell you what I understood out of this. The particulars of the disease are there, which are common symptoms, which I agree, which everybody agrees. We all know that the disease symptoms are common symptom, but there is so many times we keep prescribing on common symptoms. Why? Because maybe we don't get other things. But generals and particulars of the patient are left out in these when you take these rubrics. Now, it matters not whether these generals or particulars are masked. Now, this is very important thing. He says, when you take these rubrics, these symptoms, the generals and particulars of the patient, not of the disease, of the patient is not being taken. And then he says also, yes, I can understand that in many of the cases, the generals and the particulars are masked, suppressed by previous drugging, or never existed except in ancestral of the patient. So he's addressing that. He says it is not only physician fault because sometimes these symptoms are masked. There's so many reasons for it. Patient comes with a lot of drugging, a lot of suppression. Sometimes the symptoms are not like symptom what is happening. It is ancestral, miasmatic, and we are not able to understand, find any connection. Does it happen with you? Yeah. So what he says they must be discovered in any case or a favorable prognosis could not be declared. Yeah, this is very important. So what I understood is when you are prescribing yourself only on pathological symptom, only on disease symptom. Rather, I will not say pathological, I will say disease symptoms. We can prescribe, we have to prescribe. I'm telling you, we have to prescribe. We manage so many emergencies. We prescribe on that. Patient gets transiently better also. There could be changes in reports also. But as a physician, we have to understand that the real shift is going to happen only when we match the symptom of the disease. Sorry, symptom of the patient, not of the disease. Means the generals and particulars pertaining to the patient, not the disease. So we are not treating disease in patient, we are treating the patient in the disease. That's the entire philosophy. It goes around. Then another thing. He talks about there's another aspect. I'll come back to what I said. He says there's one aspect of hysteria he talks about. Like there are some patients who are hysteric and hypochondriac. Okay. Now, when these patients come to you, they will bombard you with lot of symptoms, especially the mental symptoms. In fact, in some place I forgot, I have not marked it. He says that you should not go deeper into some particular things too much. Don't go too deeper because it can be misguiding. So he says there are these kinds of patients who talk so much and they are hysterical and hypochondriac. As a physician, he says new physicians will always find difficulty and keep prescribing XY remedies. Whatever patient says, we try to understand, fail. As the physician increases in their practice, like years increase, then slowly and steadily he gets an idea what symptoms have to be taken and what not to be taken. Now, this reminds me of something very important is there is too much analysis, too much dependency on understanding mind symptom. Homeopaths are taught that mental symptoms are so important. And what the question is, what are real mental symptoms? Patient has depression, patient has this anxiety. They come and talk so much. They don't come and talk so much. I'll tell you, there is no need, there is no reason of talking so much. There is whatever patient is talking, and we try to go deeper into the mind, and ultimately you'll end up nowhere. Kent will at the end, I will be showing Kent lesser writings cases and try to analyze it. Even in his Mathematica, Kent, people when talk about mental symptoms, they always take support of Kent. Kent said this, Kent said this. They have a backing of Kent's philosophy. But never ever Kent said that you go deep and do scrutiny, anatomy of that symptom, the mind symptom. Go deep and deep. No, don't go deep. In fact, when you read Mathematica, Kent's lesser writing, if you don't believe me, just go today and read. Open any book, any remedy in Kent's lectures where mental symptoms are more. Just go and read and see how he has described the mental symptoms. He uses broad general symptoms. He will say hysteria, hypochondria, melancholia. He will use those broad general symptoms. He will not talk about so specific delusions, so deep understanding and going. No, it's very general. Humiliation from, punishment ailments from. Oh, a lot of sexual anxiety suppressed. That's it. He gives you a hint. Now you'll say, but in repertory, so many things are written in Kent. Yes, it is written, but not everything has to be followed, right? It's a book. I told you in the last lecture. It's a book. When you compile something, you have to compile everything. The research has to get everything into that. But as a physician, we have to understand how deep we have to go. So going very deep is very dangerous. Very dangerous. In fact, if you want to understand this aspect, I will suggest you Boger's general analysis repertory. Boger, you can just put in Google, go Boger general analysis. Boger synaptic key, the generalities, the repertory, the first part. Dr. Dhawale, the old Dhawale, he has written a very good preface for that general repertory. Just go and read that general repertory ka preface given by Dr. Dhawale. Just go and read. I read it, few months before. And thanks to Dr. Rashid Akhtar, I will always take his name. I want to give credit to all the people who have taught me. I've been watching his videos. Now you're watching my videos and learning. I've been watching his videos. I keep watching any people who are good enough, but who are good enough, I keep watching. Dr. Rashid Akhtar, Ilquds Academy, you should go and watch. Learn from him. So nice things he talks. So basic. He's really good. Very good. From there, I understood his bogus. There's a very good lecture also on Boger synoptic key. You can go and watch. I've also made one lecture. You can go and watch Dr. Rashid's lecture. So when I read Boger general analysis preface, my God, the way Boger has understood the difficulties of understanding mind symptoms is amazing. And the way he has explained why, as a homeopath, we should not initially in our practice, we should not jump in understanding the mind symptoms. See, remember, my friends, who's talking? It's Boger. Dhawale has done the preface, but Boger was student of Kent, and Boger was very much fascinated with Bonninghausen. So Boger brought everything together. Okay, just to give an idea. So he talks about those cases where he says that the mental cases that come to us, anxiety, depression, and all those things, such a case remains incurable until symptoms that stand out for the patient are also known. These generals are found if they are discovered to be changes of desires and aversion and loves and hates. Okay. So again, he talks about that the general symptom, the altered state, the general symptom has to find out. You go and read Organon, the case taking part where Henneman talks about mental disease, how to treat mental disease. There he says that in mental disease patients, you have to find out something physical generals, physical particulars of the patient, the cravings, the aversion, and specific mental symptom. Not deeper, specific. Some great delusion is there, some exact fear is there. Those symptoms has to be taken. So here also he talks about the same. When I read this, now I understand that. See, beginning of my practice, when patient used to come, I used to listen, and take everything, all notes, whatever he said, and I wanted to translate everything what patient is saying. Now I am so relaxed. Patient comes and if I know there's a problem here, I just listen to him. But I will first ground my case with physical generals, particulars, fears, broad general rubrics, and then jump to the nuances or going deeper into the case. There's no need to go deeper in the case, because it's important to form a totality on general aspect. If you can have, like, a lot of people say me that, oh sir, it is so difficult to understand mind. I'm telling you, don't understand mind. Don't understand mind for a few years. As you become senior, you will be able to understand everything. As you read more Mathematica, you will develop those skills. So what should we do? You should just focus on physical generals and particulars. First, take physical generals, particulars. Physical generals, particulars. Concomitants, aggravation, amelioration, molality. This is boring. I know this is boring, but this is the reality. This is how homeopathy practice will flourish. Then you will have, then you will have, when you have you work in this fashion, it might sound very monotonous or boring, but that's the way. That's the life is. Life is boredom, right? You have to do the same thing, good things every day. You don't have to, you're not sitting there to treat patient for your excitement. Oh, I felt so good, what a remedy. No, yeah, it can be simple remedy, but patient has to get better. Patient has to get better. Homeopathy is so simple, right? Okay, let's go ahead. Let it not be supposed that symptoms that are predicted of the disease are to be ignored or considered valueless in selecting the remedy. But they are to be considered subsequently to symptoms that are predicted to the patient. He says again the same thing. He says, what symptoms are coming from disease? You should not focus on that. He says focus on symptoms that's coming from patient. For example, he says that, like, I read somewhere, suppose I'll give you an example. Suppose a patient comes to you with ulcer, any ulcer. It could be diabetic ulcer, it could be cancerous ulcer, it could be any ulcer. Now you will look at ulcers. You keep looking at ulcers. Can you really prescribe looking at ulcers? How many rubrics you have? If you just put ulcers, for example, if patient comes, I see a lot of cancer cases. I'll give you an example. Patient comes with mammary cancer in third stage, fourth stage, disease spread. You look at mammary, you'll see debris, you'll see necrosis, you'll see cracked nipple, you'll see bleeding, you'll see pain. That's it. Maybe you palpate, you'll see some hard substance there. That's it. Other than that, what are you going to see? So, end result, disease symptom. That's what Ken says, that you cannot prescribe on end results. Then you'll ask, but there are rubrics like that. Yes, there are rubrics. You can consider those rubrics. Now, I'll be coming to that part. You can consider those rubrics, but you have to understand that the end result rubrics are last to be taken. First, disease of the patient. The patient has to be understood. Who the patient is in the disease, not the disease in the patient. So important saying is this. Okay. It has often occurred that the remedy has made brilliant cures when it suited the patient, even though it was not known to possess the strong likeness of the disease. That's what I said earlier. He says, we have seen if the symptom matches to the patient, maybe the disease symptoms are not there, but still the remedy acts wonderfully. But let likeness to be first to the patient and last to the disease. That's what he said. So the likeliness first, let it to be the patient. Yeah. Let it to the patient, then to the disease. Disease symptoms are important, but at the end stage. He says a favorable prognosis must be withheld until. Now this is very interesting, and this is the last part. I'm going to finish it off. Patient is first and the disease is last. He says it is like initiation, direction, and termination. So what happened? Now, what makes me understand this is also very important. He says initiation, direction, and termination means, in my earlier lecture, I have talked about this. What has happened right now is important. Why it has happened is more important. So you have to, that's why, go into cause, evolution. Today he's have tumor, okay. Today he has fibroid problem, okay. Today he's having bleeding, okay. Sinusitis, okay. From where it started. So you go back in the past history, the family history. You try to find out the evolution of disease. You're not able to make totality from present symptom, forget it. You go back and get all the good symptoms, make a totality, give remedy on that basis, still your present disease will go. That's what he says. Initiation, direction, and termination. First, you talk about initiation, from where it started. From where it started. Now, when you think in this term, then you will understand the role of fundamental causes. Herman said in Fifth Aphorism, fundamental causes, the miasmatic causes, the evolution of disease, from where it started, from where it began, or even in chronic disease, not if you're not thinking of, maybe it is not a miasmatic case, not every chronic case is a miasmatic case. Maybe something happened in the past. Something happened in the past. I'll share you, very nice thing where sorry, there is an interruption. So when I was talking about this, I just forgot what I was talking. Yeah, initiation, direction, and termination. Evolution of disease. No, I was saying this. I wanted to share you one case. I recently saw one patient. Okay. This lady has got many complaints. She has diabetes, but more than diabetes, she has got the other complaints, the mental symptoms, the emotional, anxiety, outburst, depression, all these things have happened with her. She has gone to many homeopaths, like she has taken few homeopath medicine. On and off, she's okay. Ultimately, 2 months before she came to me, few months before she came to me, I started listening to the patient, and when patient comes for depression, anxiety, and especially some patient keep talking, talking, talking. So she was talking a lot, and all the mental symptoms she was giving, 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 giving. I was just listening because I know till now that not everything is important. I should listen, but I should wait for it. So many things she said, this fear, that fear. I took nothing. I just listened. I was just noting down calmly. And once she finished talking, then I said, tell me one thing. When was your first attack? When did all this started? She goes back and says, now listen very carefully, very interesting case. She goes back and says, my first breakdown happened before marriage. I was absolutely fine. After marriage, my breakdown happened. I said, what happened? After marriage, first time I came, and then suddenly, say, mother-in-law, daughter-in-law syndrome started. And mother-in-law said something very bad. And that really affected me. That was first incident. I said, what do you felt at that time? No, I said, I felt very sad, very fat. I was very angry, and more than angry, I was very sad, very sad. I said, I kept on asking, what was the feeling? What was the feeling? She couldn't connect to that. Then I said, okay, what was the next bigger episode? Then she said, once, again, we had to travel somewhere out, and suddenly, mother-in-law said something. I was very happy, but she said something so bad, and that affected me so much. I went into depression. 1 month I was on bed. Now I'm thinking, what is this phenomena? Now she's talking, I don't want to talk to people, and this is today's state. But why it started? What is she sensitive about? What does she feel about that? And when I explored that, you know what she said? She said that, the way mother-in-law talks, the way she talked, it was so humiliating and insulting. I said, insulting? Yeah, I felt so humiliated and insulted. I always feel this insult. And I asked, what happens after the episode? What happens once you feel this thing? What happens? I become sad, doctor. I just lie down. I just lie down and completely depression. I don't want to talk to anybody, not listen to anybody, not look around anybody. So present state, indifference, recognizes no one in the surrounding. That is different. But what was main thing? She gets sensitive. She's a very sensitive lady. Insult. But what happens after insult? Sadness. Then I looked in Kent repertory. Sadness from insult. The remedy is Cocculus indicus. And then everything opened up. Then I understood the entire case. And a lot of different confirmatory symptoms started pouring in. I gave Cocculus. She's been doing absolutely better. Absolutely better. So many symptoms of her is completely reduced. Around 50-60% she is reduced. I don't know what is going to happen in future. Maybe some other remedy state is going to come. But this is what he's trying to say. Initiation, direction, and termination. I talked to you, I said about the cause, a mental cause, but there could be physical cause also. I'd seen one very nice case of Dr. Jaisha sir in one of our presentation that we were doing together in cancer OPD, cancer webinar. He said that he shared one case where I think of Parkinson or something, some neurological complaint was. Sir was giving a lot of remedy, nothing was happening. You know how tough these neurological conditions are. Then what he did is that after being exhausted everything, he went into the past in one of the follow-ups, and in one follow-up, what he did is the patient used to have a lot of malarial fever attacks few times. So he went there and he took fever totality. Because after that only his deterioration started, patient's deterioration. And the symptom that he took of the fever was pertaining to China. He gave China. After that, there was a great improvement in that. Now you understand. Going into the past is so important. Evolution of disease. What has to be taught to homeopath is this. He says initiation, direction, and termination. I don't know what he means, but what I have understood is this, that you go in past from where things started. You look at evolution, the course of illness, try to understand it, connect to the cause, fundamental cause, environmental cause, emotional cause, physical cause, lifestyle cause. Then you will understand the classification of disease, Henman's classification of disease. When you should go and read Henman's classification of disease. Not all chronic cases has to be treated with medicines. So we should know where we should treat and what we should not treat. The real chronic disease we have to treat. Others are lifestyle and other things are there, right? Okay, I'll not go into that deep. Now he says, in the prospective Thesical patient, he says, prospective Thesical means tubercular patient. We see a patient with few symptoms of patient himself, but weakness. So he says, if suppose a tuberculosis patient comes to us, we will rather see very less symptoms of patient. He says now, symptoms of patient, symptoms of disease. We will see less symptoms of patient. But what we'll see? Weakness, loss of flesh, anemia, coldness, tired from all exertion, bad reaction, easily disturbed by eating, drinking, exposure, loss of sleep, and weather changes. These states are common to so many remedies that it will at once be seen that the patient is not represented and no promise can be made, though there is no signs of tuberculosis. A favorable prognosis must be withheld. Now he says, when a patient comes, he is giving one example, like a pathological case comes. Now, this is the practical difficulty that I am facing. I am seeing patients since such a long time, all pathological cases. This is the difficulty that I face. That when patient comes in that condition, then a lot of bad tissue changes have already, end result organ has already been damaged. You see more disease symptoms. The person's symptom is somehow suppressed or it is masked, maybe. He says a favorable prognosis must be withheld. Withheld until a series of carefully selected remedies has been used and the symptoms that represent the patient begin to appear, such as mental symptoms or other generals too well known to need to description. He says the real cure will not happen. You withheld till the real state has to come. Means the real symptom of the patient has to come, the mentals and the general symptom. Now, it is very important to understand. Now, what he says here that the real prognosis withheld until the series of carefully selected remedies has been used and the symptoms that present to the patient begin. Means he's saying that in these types of pathological cases where end result or disease symptoms are more, you will have to use series of lot of remedies. Now, what are these remedies that you are going to use? Because symptoms of patients are not there. Then what remedies are you going to use? On what basis? It is going to be whatever remedies you will use. He says you keep using series of remedies, partial symptom remedies, and then slowly, a time will come when the symptom of the patient comes in. Means his mental symptoms, his general symptoms of patient will keep coming, and that is a time you know that yes, now you can really help the patient. Until then, you can keep giving remedies, but you should know that real cure is not going to happen. Now I come to the conclusion. What I have understood about this, many a times we are seeing, so let me put it in this way. As a homeopathic physician, we all know whatever Kent said is absolutely correct. Absolutely correct. That is our ultimate goal, that we should prescribe on general symptoms, patient's general symptom, whether mental or particular or physical. Patient symptom. When you get those things, you should be very confident that yes, I've got so many cases now where I'll tell you, even in bad pathological cases, very few remedies I have given. Bedridden patients I have been able to help. But I can tell you more than that, I've got so many patients where I've been struggling so much, I can't tell you. Because I'm struggling to get the symptoms of the patient. So now, what is he saying? He's saying use series of what to do then. The question is what to do then. This is ideal. That's okay. But if I don't get, then what to do? He says use series of remedies. So when using series of remedies, what is he saying? He's saying exactly what Burnett says. That's what I wanted to come to. What did Burnett say? A lot of people say Burnett specific prescriber, a lot of remedies. No, the type of cases Burnett saw were these cases where disease symptoms were more. So he had to use pathological rubrics. He had to use Boric-like symptoms. He was in a Cooper-T club, like Clark's dictionary medicines, some specifics, some mother tinctures, some biochemics. He had to use. And I've done little work on Burnett. I've posted a lot of videos also. If you can watch those cases, which I have tried to analyze, you can go and read for yourself also. He keeps on giving, and a time comes when the real state comes up. And then he gives that and the patient is better. So the fight between Kent and specifics and pathologies ended here for me. No confusion in head. So now patient comes, I know idealistically, I have to prescribe for the patient. Definitely have to prescribe for the patient. And whatever he said. But there can be cases where disease symptoms are much more, much more. So then, hence it is very important for me to learn Borix Matremedica. Hence it is very important for me to learn Boger Synoptic, the Fataks, the smaller remedies, which can help me. Hence it is very important for me to look into pathological rubrics. Earlier he talked about those rubrics not to see, but there are cases where only pathogenetic symptoms are more. Pathology is speaking more. So you have to, maybe it is a common symptom, but sometimes you have to prescribe on those common symptoms. You have to learn about organopathy and give. And step by step, Burnett says, as you peel off the layer, it's one layer, another layer, another layer, and then slowly, the real state comes up. But in our mind, we should always know that first, we should aim for symptoms of the patient. So if patient comes in pathology, you cannot say that I will use, all specifics. No. First try to get the symptom of the patient, which Kent is talking. If you get that, pathology doesn't matter if it matches to the remedy. I'm telling you, it doesn't matter. But in those cases where it is tough, it is masked, the symptoms of the patient are masked, then the use of Burnett theory and specific books, the mother tinctures and disease symptoms, the common symptoms has to be used in practice. Okay, guys. So that was something very important. And as I read this now, these things were going in my mind. So I just wanted to share with my people. And please write in the comment what do you think about it. And this has given me a lot of clarity. And I don't have any confusion in practicing. I know what is ideal, but at the same time, I also know that I have to manage crisis also. And that's how we keep learning together. And our all great masters, we should love everybody. And the ideal thing that a homeopath should do, in my opinion, is that we have to incorporate teachings of all the great masters: Kent, Boger, Fatak, Boric, Burnett, Clark. It could be anyone, the classics. We have to engross ourselves in reading those literatures more and more, and especially lesser writings. You will get so many hints in lesser writings. I can't tell you. I am thoroughly enjoying it. And I'll be keeping posting whichever I feel in this fashion, also in presentation form, whatever best I can do. That's the reason I've started my YouTube channel, so that I can express myself here and for the betterment of homeopathy and homeopaths. Idea is you get inspired to go and read more, to analyze more, and you, whatever you learn, you share it with the world. That's how homeopathy is going to prosper. Thank you very much.